Welcome, everyone. We're going to just wait a couple minutes to just allow some time for people to join us, and then we'll go ahead and get started. If you want in the chat, you can go ahead and just put your name and what
Hey, hey.
organization you're with.
So I have start tomorrow.
All right, we'll go ahead and get started. So thank you everyone for joining us today. We're going to actually be talking about how partnerships across systems can really strengthen support for students. And I'm really excited to introduce Singh from California School-Based Health Alliance, who many of you guys may know from the Inland Empire Coalition, School-Based Health Coalition. She's here to share great information that she knows from across the state. But we also have Kara Molina with us. She's the Director of Student Health and Wellness at Ontario Montclair School District, who has been doing this work for years, and she brings great experience from one of the more advanced systems here in our county. So with that being said, I would like to welcome Singh and Kara.
Yeah, thanks, Mara. And it's so nice to see some familiar names, and I can't see faces yet. Let me just do a screen share. But yeah, we at CSHA really appreciate this partnership that we have with SPCSS. We were just talking before we let everybody know from the waiting room that we're wrapping up 4 years of this partnership in really trying to build the capacity of the Inland Empire, area and really help to advance the school healthcare movement in our area. And after 4 years at Mara, I think we've done maybe 14, 15 webinars, and I know that all of you will receive an email with a link to the live binder, which has all of the materials that we're presenting, as well as recordings from other past webinars and things like that. But, we'd love to just continue to do this for the field and not only to build capacity, but also to lift the great work that's happening in the field. And so I'm really pleased today to co-present with Kara Molina of OMSD, Ontario Montclair School District. I think about I was gonna say I got Olympic tickets, by the way. But the only sport I got tickets to was volleyball over the weekend. And I feel like this is like volleyball, right? Where I'm kind of just setting up the ball, but Kara's gonna be the one doing the spike, for this webinar, because I just gonna kind of do a context, for all of you about behavioral health
So
services.
please do not tell my parents about this. I am not going to talk to your parents.
Oh, okay. Yeah, thanks, Mar, for helping to mute people. Let me just do a quick introduction and I'll let Kara go. But like Mar said, I'm Sang. I'm with the California School-Based Health Alliance. I've been working in school-based healthcare for the last 20 years, and most of those years we're actually supporting wellness centers and school-based health centers in Los Angeles Unified School District. And that's where I've learned most of, what I do know and continue to still learn from the field. And my training is actually in public health, although I've been really fortunate to really get into the behavioral health, mental health space as well. And like Mara said, I support our Inland Empire School Health Coalition, which I'll have a slide later at the end, just so that way we all can see that. But we really are so pleased that we're growing the movement in the region to have people understand this model and how it really does support student success, whether you're coming at it from community schools lens or just, from student support services. Kara, do you want to take a moment to introduce yourself?
Sure. So my name is Kara Molina, Executive Director of Health and Wellness Services. I'll go into exactly what that means in a little bit, but I just really want to publicly thank both Sang and Marwa for inviting me to be part of today and really championing this work because it's so needed. And I appreciate both of you for all that you're doing to support.
Yeah, great. Okay, let me get all this on. For those of you who don't know, the California School-Based Health Alliance, CSHA, we are a statewide nonprofit organization. We're actually based in Oakland, but we work statewide, and we've been around for about 30 plus years. Really largely serving initially the Bay Area and then Los Angeles, but now we support the Inland Empire, the northern part of California, the Central Valley, and then just other smaller pockets throughout California. But the idea is, to advance the school-based healthcare movement in the state, while we don't have like a full-blown like school-based health program at the state level like many other states, but that's okay. California still does progressive things. And of course, we always invite membership to the organization, which is a very nominal fee, and you get exclusive benefits. But most importantly, you get the conference discounts, which actually our conference is in 2 weeks from yesterday. So it's that springtime where we're really happy to bring people from all over the state together. And I think we're expecting about 700 people at our conference this year, which is really fantastic. 700 people who are supporting and involved in the school-based healthcare work. And so we're excited about that. These are our learning objectives, really want to look at some of the guiding principles and then also have you think about, how you explore partnerships between LEAs and community-based partners, and then also look at some of the funding streams to support some of this work. And I know I'll have a slide on that, but Kara's gonna actually talk about, how she's been able to finance, all the efforts that are happening at OMSD over the years. And so that's always a question that many people have, right? Great, you're doing all this great programming and all these interventions, but how are you all paying for this, right? That's always, the question of the day. This is not a surprise to anybody, but I just like to let everyone sit with this for a minute, because I think this is sort of the why, right, of why we do this work, and the how. Schools are the ideal location for students to access mental health, and in fact, the vast majority of people who do, or children and adolescents who do access services do so at school. And so we like to think of school-based healthcare, and particularly behavioral health services, as really a place-based initiative, right? Where, this is a place in our community where it's so trusted, it's safe, it's, we have trained personnel, but really it helps to break down barriers to access. And also when we're able to provide these types of services at school settings, we also help to reduce the stigma. And most importantly, support that idea of the whole child model, right? Where when students come to school, they can access, breakfast and lunch and academic support and other types of support services, including health services, behavioral health, oral health care, and so many other things that we are really now coming around to understanding what social care is about, right? Like the fact that we're actually doing social care at school by way of school health centers, wellness centers, and other, I think, programs, I think speaks to this really, I think this paradigm shift in how we think about education, public education particularly, and how and what that entails in order to serve the students that we do and also their families. And so again, just schools are really the ideal location. And I always like to make sure that we take a moment to grasp that, and that helps to think about why we're doing it and how we want to do it. Sometimes I do a lot of sort of school-based healthcare 101, but today's not the day. But I do want to share this, and that is that mental health services are actually the most common type of services provided by school-based health centers and wellness centers. In California, we have over 400, about 420 or so of these sites. And now we're looking at, 80% have these services. 10 years ago, this was flipped. It used to be medical services. Medical services was like the most common thing that we saw at school-based health centers. And I want to say it's been about a decade since we've seen this switch. And, I think all of you who are on here will recognize that, finally we have this recognition, right, on not just like social emotional learning and health, but then the fact that this is really probably one of the most pressing concerns among our children and adolescents is their mental health, emotional health, behavioral health. And so it's not a surprise that the graph has now switched. Of course, all these services are important, but I think this is telling of sort of where we are as a community and as a society, and really where we are in public education in California, and including, you know, what is happening at the statewide level with the transformation of our mental health services. So I find that interesting as somebody who's been in the field for 20 years to see this transformation, you know, and I suspect it'll stay this way at least, you know, for the next 5, 10 years, especially as we're undergoing, you know, all the financing changes with CYBHI and things like that. What makes school-based health centers effective? I tend to share a list a lot with, you know, in different webinars, and these are sort of like the basis of school-based healthcare, right? When we have clinics on campus, and particularly the services that are provided in clinics, you know, what that means is that it helps to enhance access to care, right? This is really about this is place-based initiative, really about access. We're also able to do a lot more prevention and population health, right? Whether it's screenings or campaigns or things like that. You know, that's kind of the beauty of having a school-based health program at schools, is to be able to do that. This model also allows us to provide much more intensive support for the highest need students, and we're able to identify who those high need students are in a landscape or in a setting like schools much more effectively than, you know, other environments. And then ultimately, you know, all of us who are doing this work, regardless of where you're coming from and sort of what your profession is, at the end of the day, we are there to support the mission of the school, which is, you know, academic achievement and student success. And then, of course, having school-based health centers on school campuses help to also integrate, to improve the integration, you know, in the healthcare system. Again, schools being another point, you know, of access for healthcare. And then in terms of thinking about behavioral health services, you know, what should that look like, and how should we approach that? These are sort of the 6 overarching, you know, tips that we like to share, and you know, we can even spend. In fact, we have webinars and conference sessions just, you know, on each one of these, but here I'm just going to go through them really quickly, and that is, you know, services should build from and complement a positive school climate, right? We know positive school climate is one of the predictors, right, of student retention and success and student well-being. And that services should be available to all students, particularly PEI services, although I know that we may not be using the term PEI much longer, depending on how Prop 1 plays out. And that providers, you know, community providers, county, what have you, that really they should be working with school staff and teams, and such as costs. And many of you are probably already involved with, you know, your cost teams. Providers serve as a resource to teachers and their school staff. We see this a lot in health education, health promotion, and screenings, you know, where you know, the school-based health center, the wellness center, you know, really are embedded within the school environment and with teachers and staff. And then this orange box here is really what today is really about, and that is that schools and districts partner with county and community agencies. You know, I always like to say that schools are in the business of education and not necessarily healthcare, but our community partners in county behavioral health, county public health are in the business of healthcare. So how do we integrate those two systems, right, to really be able to serve the children? And so this is really about, you know, being able to leverage, you know, agencies and people and organizations, you know, in the community. And then lastly, services are structured within a 3-tier system. And of course, many of you are all very familiar with the 3-tiered system of services. And speaking of that, you know, this is an interesting way to look at, you know, the fact that we all have a place, right, in the service delivery model, whether you're coming from as a district or school staff versus a community partner staff, in terms of being able to really focus in on, like, you know, your level of services and intervention. Whether it's, you know, for district staff really supporting, you know, heavily tier 1, and then for our community and partner staff to really focus heavily on more of the targeted intensive interventions. Not to say that district staff don't do that, but I think it's really trying to understand, you know, how we utilize the resources that we have, and also thinking about how best to serve, you know, students from a general population health level, but then also much more targeted intensive level. Okay, so I'm not going to spend too much time on this, but I'm really happy to include this in the slide because I want all of you to have access to it later when you're able to download the deck, but also to take this back and really think about how to pay for all this. And so this is somewhat complicated, but this is basically, and we keep adding to this slide, like every few months we're like, okay, what else can we do here? But this is these are the ongoing funding streams in California based on the tiered system of delivery of services, right? Tier 1, Tier 2, and Tier 3. The left-hand side, the blue bars and the fonts represent funding sources that are administered by our education partners. And so Kara's going to actually have the slide back towards the end of her presentation and talk about, which of these funding sources she's able to access in order to pay for just the wealth of services that OMSD is offering, but just kind of give you a sense of where things are. And then the orange bars are the funding sources administered by health partners. And of course, the exciting thing that we've all been talking about, and I actually, Kara asked me to make that in larger font, is the CSBHA fee schedule. That's kind of where all of our heads have been for the last couple of years, with many districts, having, a part of like the pilot cohorts and what have you. But the exciting thing is that this is actually going to be drawn down by both education and health partners. I think that our health partners are sort of not, I don't want to say a little behind, but I think the on-ramping of the health partners are coming a little bit later than our education partners. But I always say, the train sort of has left the station, right? It's a matter of who's hopping on board, at what station, and also that this is the way of us going forward. As part of the transformation efforts in California, these services, we can provide these services and they will be paid for. It's just a matter of really building that infrastructure so that way, districts are able to draw down. And then, of course, many of are aware of the exciting things about, new providers, like community wellness, no, what do we call them? Wellness coaches. Yeah. Who are now part of the provider list. And so just some really exciting time for us in California, but also to say that, funding sources are available. They are not easy to understand. And even the slide here, it's like, ugh, but the fact that, we're going to really give Kara a chance to talk about her program to say, yeah, it's possible. It's possible because we know they have a excuse my language, with a badass executive director like Kara, who really understand the landscape and could draw down and really support the really the large volume of providers and clinicians and staff that they've been able to do to serve the community. Okay, so I'm going to stop there and then turn it over to Kara, but I just want all of you to I'll come back a little bit later towards the end, to offer some resources. But, as we are, continuing this partnership with SBCSS and as a state alliance, I think what we're ultimately about is how do we help to strengthen the infrastructure at your schools and your districts so that way you're able to serve children and adolescents in ways that they really need. And we know this is one such topic. Kara, thank you for allowing us to learn from you today and just to highlight all the great work you're doing. So I'll pass off to you.
Awesome. Thank you. Thank you so much. I know it just really comes from a heart of wanting to overcome barriers for students and families and really increasing that access to education, accessing possibilities. And I'm so fortunate that I got to build upon what was already here in Ontario, Montclair. And so we just keep growing and growing. So just for some context, we do have 34 schools for over 18,000 students. We are primarily low socioeconomic disadvantaged. As a matter of fact, even though our free and reduced is 87%, because we also community qualify, we're actually 100% free breakfast, lunch, and dinner for those that qualify in after school programs. So it's, just to give you some context around the community that we serve. We also have 14% identified experiencing homelessness. And I know last year, it was the highest percentage in the county. So 14% doesn't always sound like a lot, but we're talking 14% of students, over 18,000 students, it's quite a bit. So really just have this heart, this passion for overcoming barriers for our families. So next slide. So people often ask me, what is health and wellness services? And the short version is it's everything, not curriculum, not special education, right? So, but I do oversee our district-wide implementation of community schools. We do have 29 schools that received the grant. But even the final 5 schools that didn't receive the grant because of not meeting the priority unduplicated count, our district did commit to matched funds. So all 34 of our schools operate that way. We've actually been doing community schools work. We're going into year 29. So we've been doing this for a very long time. And please know what I'm presenting today is not where we started. It's just exciting to me to see, where our colleagues are starting and what it can potentially look like. And we're still not done. So we're still growing. So it's also oversee quite a bit of other things, everything from MTSS, PBIS, social emotional learning. I do have in-district staffed mental health, case management, and crisis responders. I also do oversee homelessness and physical health, so all of our nurses, and then our medical billing. We actually have several programs that we do billing process for. And then the school outreach staff, that's the 80 site staff that you see on the bottom of the slide. So directly in my department, I have 106 staff members, and then another 40 university interns that we bring on every year. And then again, directly supporting those 80 school outreach staff members. I didn't include it on the slide, but there's another 30 behavioral health service providers that I support. They just work directly under a different director, but all of the behavioral health pieces, I do support them as well. So quite a huge group of individuals really wanting to support students and families to accomplish what we do. Next slide. So we always start with prevention, early intervention. And when we talk prevention, early intervention, it's not just about the students. We know many of us have what those structures look like for tier 1, tier 2, tier 3 student intervention and support at the school level. And so we have all of those things in place as well, but we always want to think about whole child, whole community, whole family. And so we really do take the time to invest in providing both family workshops, staff training, and community workshops as well. So part of the work that we do serve as a county mental health and case management service provider, which I'll talk about in a moment, but really wanting to involve like a whole community approach. So we do lots of different engagement opportunities. We do lots of we have many campaigns that you can see there, like September Suicide, October Red Ribbon, November Homeless Awareness, really wanting to spread awareness to try to be on that prevention. And I love what Sang said, that we know that it might not be around forever. We're hearing that it's going to be more EI instead of PEI. But yeah, we're adapting it and, of course, evolving as we're able to. And this is just a sampling of some of the trainings that we provide both to families and to staff. But just really wanting to have us all speaking a common language so that when we're having conversations with families, with community members, that we're all on the same page. Next slide. And so when more intensive services are needed, again, remember we have those 80 site service providers that are directly at the site. Each site has both a certificated and a classified individual that provide that behavioral services. So when a higher level of need is necessary, we do have those outreach staff connect with my team to really come together to find out what services are available to match the need, right? We don't want to just do blanket, everyone gets mental health, counseling referral, or blanket, everyone needs case management. Every situation is unique and every situation needs to be kind of teased out a little bit. So we have that outreach staff connect with one of my clinical supervisors to really talk through what the referrals for additional intensified services are. And then that way we can connect to either in-district providers, which is the majority of where our students and families are serviced. But then there are, specific situations where we do connect with some outside providers as well. But just really want to emphasize matching that need to the service. Next slide. So the first one that I'll start with is our Family Resource Center. So this is where we provide case management services. I do have two clinical supervisors that oversee the team. We have a 7 intervention specialist. We have BSW university interns that support for additional service providers. We also provide 2 insurance enrollment specialists that can connect families to either Covered California, Medi-Cal, or even help in any other kinds of insurance enrollment needs. Really want to be able to provide quick access so that they can be enrolled in some type of coverage that they qualify for. In my department, I also have a transportation driver. This is actually really cool. I just was really excited that we have this. So this isn't about transportation for homelessness services, which I do oversee, but I actually work with our transportation department to make that happen. And we provide that in-house. And it's not about transportation to and from school. This transportation driver is directly supporting students and families getting to either medical or mental health appointments. So we take our students, our families all over from, wherever they need to be. We take them out to Orange County, we take them out to Chalk, we take them out to LA, wherever they need to get to. If they don't have access, we really want to, eliminate that barrier and provide support in that way. So to me, that's really exciting. So that's not the barrier to access any of those specialty services that they're needing. And then we also have our community partners. And so with our community partners, in order to have a really comprehensive case management service for all of our students and families, super important that we establish and continue our community partners, because there is only so much that we're provided funding as an LEA to provide things like, school supplies and basic needs items, food, clothing. Obviously, we don't have hotels handy. And so we're really wanting to think about how do you partner with the community to provide a very comprehensive service so that any need that we're coming across, we're able to overcome that barrier and provide access to that. So every year, this team in particular goes on a community field trip. And so they connect with all of our existing community partners. And then they also look around to see, are there any additional community partners that have popped up that perhaps just haven't connected to a school district, or realize that there could be a strong connection where we're mutually benefiting each other. And so that is really great to see when our team goes out into the community every fall, and again, just reestablish those connections and then build new partners as we go. There's a lot of community partners popping up, especially with CYBHI coming on board. And so really wanting to maximize and really connect our families to the resources that are in their own backyard. We do provide that bilingual staff and have the ability to do in-person and telehealth. But we definitely want, for us, primarily it's in-person services, whether it's at the school site, because at all of our school sites, we do have community resource centers that we've established so that they can either come to our Linda Vista, our service center, which is on that Sultana address you see, or if we're providing those services directly at the school site. Next slide.
Yeah, Kara, I'm sorry. I wanted
yeah.
to ask just 2 things for the insurance enrollment specialist. Do they also do like HealthFresh enrollment too, or is it just specific to healthcare coverage?
So their primary is healthcare coverage, but we don't say no to any needs that our families have. So yes, they will actually absolutely help them with that, either them or the intervention specialists, who are AKA case managers. So they'll help them with those applications, even applications for like housing programs. Whatever you can imagine, the whole goal is that we're walking side by side with families to lift them up and support them on their path.
Yeah, so I was gonna say, if you're lacking health insurance coverage, I'm sure there's other associated, social determinants, right? Like access to, food and things like that. And then, sorry, one more question. You talked a lot about the community partners. I know that that's what we always say too. And I know every school district and schools, that's just something we have to do in this education space. But like, do you all have you created like a checklist or a sort of a guide, to help community partners who want to partner with your district to think about, okay, here's what partnership looks like, here's what's needed, here's what we need to go through, whether it's an MOU or a data sharing agreement, and what have you. Like, is there some sort of like system set up to really help facilitate that? Because I know that sometimes it's daunting to say, oh, well, form partnerships with community agencies, but then, like how do you like actually like facilitate that?
Yeah, thanks for asking. So we facilitated through board approved MOUs or contracts, depending on the community partner. Some have MOUs, some are contracts, but we establish the very specific supports that are mutually beneficial to each other, whether we're supporting them and they're supporting us. So an example of that is recently we used to have a weekend food pack community partner that supported about half of our schools. And that particular partner, because they're going through their own reductions, had to limit to only one school for the school year. And so, but of course, for us, we didn't want to say, well, we no longer have that program. So what my team did was they just scoured to see what other programs are out there. And so then we found a new community partner, and we contacted them to find out would it be a possibility. We established an MOU. I actually have my CBO look at all of our MOUs and contracts just to make sure the language is great. And then we were able to establish that. And so there was no disruption of service where we were able to provide those weekend food packs. And we actually only had about a 2-month notice that the previous partner was reducing. And so we were able to make sure that there was no disruption. We did it all during the summer and had it ready to go in the fall. Yeah. Next slide. And then when we're talking about mental health services, so I have 2 strands of being able to provide mental health services directly in district, and then of course our community specialty partners. But first is our counseling center was staffed with licensed clinical therapists. And so they're able to provide services, whether it's through a student's IEP for ERMs or education-related mental health services, or they also do billable services for Medi-Cal eligible students, and we do that through billing EPSDT or early periodic EPS screening and diagnostic services. And so that's where you're billing Medi-Cal for those services. So part of that is in partnership with the San Bernardino County Department of Behavioral Health. And so we have a contract with them to be able to provide those services. But we also have a lot of families that either are uninsured or some that do have private insurance. And so we have a tandem sister contract to provide mental health services through a team of clinical service supervisors that oversee university, graduate level university interns. And so that's where our extra 36 university interns on the mental health side come into play. So where we're able to provide mental health services to either, like I said, uninsured or students with private insurance that are having difficulty accessing those mental health services outside of the school setting. And then in addition, not only were my licensed clinical therapists, they're restricted to only providing services to students. Our mental health intern team program can provide mental health services to students, but also to the families, also to adults. And so that's again where we're coming from, an idea of supporting whole child, whole family, whole community, and really wanting to increase healing together. And so we're able to really provide that service as needed. And then when there are very specific, unique scenarios or highly intensive that go beyond either my intern program or my licensed clinical therapist program, we do connect with community partners for those specialty services for that most intensified level of care. We always use that as a last resort because we want to be able to provide as much as possible in the district setting, mostly because we know that we're able to walk side by side with them when they're being provided services in district. With our partners, we still walk side by side with them, but some of those steps required the families to do things that we're not able to monitor as closely. And so that's where we have really strong connections with our partners. So it's all about relationships, right? So if you're having those strong relationships with your partners, they were able to connect because we do have those release of information and established for our families where we're able to talk with our partners directly with my team and still walk side by side with them. So again, it's directly side by side with in-house. And then for some of those community partners, we're still walking with them, but a little bit different because it's not directly our service and it's contingent on the families doing their part to make sure those services are happening. But still provide again with bilingual staff, individual. We also do group therapy, so it's not limited to just the one-on-one. We can provide those group therapy as well. And again, those wellness centers that we were talking about at the school site. So we can either provide it at the Sultana address, we can provide it at our counseling center, at our Bonview Avenue address, or we can provide those services directly at school sites because we did install 17 wellness spaces where it does have HIPAA compliant direct service space through one of our funding streams. And so that just increases our ability to provide those services. Next slide. And then we want to make sure we're really looking again whole child. So we want to, because I do have the nurses and LVNs and health assistants under my department, it's really actually kind of beautiful where we can really integrate both the physical health and social, emotional, mental health, behavioral health services all together under one department. And so they're really talking to each other because we know a lot of our school nurses are providing those behavioral health services to our students. They do have that element of what they're doing. We have 18 nurses in our school district for 34 schools. We do have another 27 LVNs. And then we have 11 health assistants. What we're actually doing because of the rise of students that need medical procedures or diabetic support, every time a health assistant leaves our district, we're actually replacing with an LVN. So eventually it will only be RNs and LVNs because of the need that we have. It's just the numbers have increased significantly. And so what we do to make sure that not only are they being provided services from our health team, but we partner with Park Tree Community Health, where they actually have a location at our Sultana Avenue Family Resource Center, where they provide both medical services and dental services, which are really cool. When we partnered with them, when we first began, they were doing those two services, but they weren't providing immunizations for all students, just the students that would go. Well, now, as of last year, we started where Park Tree we established a contract, an MOU with them specific to providing immunizations for all students, regardless of insurance coverage. So any student from OMSD can walk in when we're having the immunization clinics, and they can get it free of charge, no questions asked, because we want to make it as easy as possible for families to be able to access and not have any of the barriers of missing immunizations to enrollment in school. So that was really cool. Next slide.
Oh, can I just ask? I love that you all have this partnership with Park Tree Community Health Center, which is an FQHC, a federally qualified health center. And we know that in California, for school-based health centers and wellness centers, about 50% of sites actually are operated in partnership with an FQHC. We don't necessarily say one type of model is better than the other, but the FQHC model tends to be a bit more sustainable because they can draw a lot more from federal funds and participate in like the VFC program, Vaccines for Children, and things like that. But I was gonna say some of the FQs like who help support school-based health centers and wellness centers and LAUSD also bring in the behavioral health piece. Do they also do that too, or are they just limited to medical and dental?
They only do medical and dental for us, but the reason is because we have such a comprehensive behavioral health staffed individuals in our district. That's just not a need that we would have, but I know that some do that. An entity, I forgot the name, but recently contacted to let me know, like, hey, we could provide this services. For us, it's because we have them staffed. So we wouldn't replace it with like a community partner who could provide the same service because we have staffed individuals in our district for those services.
Got it.
Yeah, and they do provide both at the clinic, but they also push out to the schools and provide like preventative dental screenings and early services as well. So it's not limited to just being at Park Tree at that Sultana address.
Yeah, and I love, Chair, how you said they're now doing immunizations, at a more school-wide level, right? Not just their patients, but whoever needs it. And then that's one of the beauty of like working, and partnering with an FQHC is that they're able to do that and figure out the financing of it, right? But that's what I mean about like, school-based health centers being able to really do some population health level activities. And so it's great. I'm gonna get you to the next slide.
Yeah, no worries. And then the most intensive service we do provide is that crisis response. So I believe most districts in our county will contact, CCRT or the Community Crisis Response Team, who does a beautiful job. But just for us, we're able to actually limit our contact to CCRT until we suspect possible need for hospitalization, because I do have district staff that can respond to these crises. They're clinically licensed staff. And so whether it's being individual, danger to self, danger to others, we have a district protocol that we follow. And then only at the time that we suspect possible hospitalization, because we can't do that, right? We don't have those services. We do connect with CCRT. So they tend to know that when we call, that's what they're coming out for. Because we're able to do so much in-house. And then not only with individuals, but we have school and community-wide crisis we respond to. It could be loss of a student, staff, or family member, community trauma. A few years back, we had fireworks go off that actually there were some fatalities. So many of our community members had damage to their homes. So lots of community trauma there. We had another situation where a student was actually shot in a park in one of our areas. So there was community trauma there. So, any kind of social injustice, we're really able to respond to whatever is happening. And then we also want to make sure that when our students come back, that it's not just, oh, hello, surprise, you're back. We're developing those reentry plans and safety plans to make sure that after the crisis, their still supports are in place. We want to make sure that they're able to identify, what is safe for them, whether it's homicidal or suicidal ideation, just really wanting to make sure we're thinking about the whole loop of really providing whole wellness. Next slide. So when I'm talking about those partners, this is a little, I'm super visual, so I put some visuals on here. So this is an example of the team going out into the community. You can see where they're visiting existing community partners, looking for additional community partners. These are just a few of the partners that we do, very highly engaged with. Both of our cities, Montclair and Ontario, they have tremendous supports for the work that we do. And so we're able to connect with both of them directly for just so many different offerings that we can provide our communities. And then again, like Children's Fund, Shoes That Fit, Assistance League, United Way. I mean, we just blend it all together so we can really provide whatever is needed. And again, my team is always out there looking to see who else can we bring in and partner with so that we can really provide all that we possibly can to overcome barriers. Next slide. So what we do after is we have our community resource book. And so while we do provide such a comprehensive system of care in district, we also want very handy all of the resources that we have or increase with. And so we update this community resource. We call it the flip book. And so we also print out paper versions for anyone that needs paper, but you can note that link. It's a live link that you should all have access to. And so we're able to update that with not only community partnerships that we have, but other community resources that we have already connected with that we know are available to our families. Because part of what we're really wanting to do is help our families, our students really realize like the resources that are at their fingertips in their own community to increase that connection to their community. And so having all of that in there that gets updated every day, as well as our link tree. We have the flip book there. We're on social media. We also have our website. Our district just changed websites, and so you'll still see the live link there when you go to Linktree, but we're ongoing, trying updating that as well. So we really like, the idea is to have everything at the fingertips of whoever needs it, whether it's one of our outreach staff at the sites that need to connect with a family with a resource, or families themselves, or community members that we work with, or the families. So we just really want to make sure that, or even my own team sometimes, there's so many resources that you can't memorize them all. So we want to make sure everything's at their fingertips. Next slide. So connecting back to SING's visual for funding. So how do we make this happen? So often I'll hear about districts that are able to pull in some programs because of LCAP funding. We just don't happen to do that, but I will tell you it's a very specific reason why. So when I came in to become the director of this department, I heard from my team very loud and clear that they were always very nervous, because if part of our program was dependent on the local control or LCAP funds, LCFF, what that means is when times get lean, like most of you are experiencing now, right? There's cutbacks in education. What's the first thing to get cut? Well, it would be things like behavioral health services, mental health services, because while those are very important things to have when you're talking about in an educational setting, behavioral health, mental health, case management, but you can't cut curriculum. You can't cut, certain things that have to do with the education process. And so what we did when I came on as director in 2019, of course, right before COVID, right, is to remove as much as possible out of LCAP funding and really not have to be dependent on that. And where we're seeing the fruits of that labor is now when we're in a time of cuts. In the education world, on the curriculum and instruction side, we're seeing some pretty heavy cuts, but we're not having cuts for behavioral health, mental health, case management. It's actually the opposite. We're growing. And the reason why is because I really do believe in a strong, braided, multiple funded program. There's no one funding source that will make any program happen. It's really connected to blending and braiding of funding. So like I had shared earlier, we do tap in, and I circled all of them on the same slide, to the ERMS, or educational related mental health services. And I didn't circle it because I know that's the community side, but our equivalent to that is CalAIM, which is currently EPSDT, or a SATS program through DBH, but it's actually transitioning to CalAIM. So we're actually transitioning to CalAIM since we are a community provider as well in a school district setting. So those are my two supportive funding streams. We do LEA BOP. We've been doing that for years, and that's how we were able to capitalize and start fee schedule billing so quickly. We were the first LEA in our county to successfully generate revenue through fee schedule. It was like $10, but we were super excited. But now we're obviously well beyond that. But yeah, so we got fee schedule up and running. I've got, I think like 170 individuals that are able to bill for that. And then Title I, Title IV funding, I use that as well. Again, I didn't circle LCFF, local control, because we don't really use that, and it was intentional so that we weren't dependent on what was happening. If we ever get some, we're grateful, but we're not dependent on it. And then of course that school-based medical administrative activities, small money. So we do have that in our district as well. So lots of billing sources. Lots of things that we tap into, but we don't stop there. We keep going. So if you go to the next slide, here's a small sampling of what we're currently using. So again, we had the community schools grants. We're actually at the tail end. We're going into year 5 next year, but a lot of our schools, they're running out of that funding, so we're switching over to fee schedule for that. CYBHI also had SBHC money, that Student Behavioral Health Incentive Program. That's how we put our wellness centers in place. The billing programs, we use all 3. Again, the fee schedule, we use LEA BOP, and that EPSDT Medical for school age school age treatment programs, or SATs. We connect with DBH, and we have that prevention early intervention contract. I use the state and federal mental health money, including ERMS, but not limited to ERMS. The McKinney-Vento, both a grant and title funding. We partnered with City of Montclair because they received the HHAP grant, and then we actually just applied for one as well. So that's another example. I partner with our director who oversees ELOP, and to make sure that we're, I'm complementing him, providing him, nursing and LVN support, and he's complementing providing additional time to provide behavioral health services after school as well as during the day. And then again, those community partnerships, private, local, like you name it, we try to find it. It doesn't matter if it's a grant for $10,000 or multiple millions of dollars. I do have someone on my staff that her job is to look to see what grant sources are available both at a local, state, and federal level, and then to make sure we're compliant with those as well. So just encourage you to be open to any kinds of grants that you see out there, because so much can happen with multiple funding streams and being able to blend those and braid those funding streams together.
I was gonna say, Kara, if we were to put all this like in a pie chart, I mean, you'd have so many slices, but is there like one slice that really stands out, either now or sort of projected near future? Like, if there is one that stands out, what would that be?
I'm sorry, I don't understand the question.
Oh, I'm saying like between this slide and this previous slide, like there's just so many different funding streams you're drawing down on, right? And so if we would put all this in a pie chart, I'm just saying there's like 20 slices, you know what I mean? It's a big pizza, right?
Yes.
But is there like a bigger piece than a bigger piece than other pieces of the pie?
For sure. I mean, an example is for us in our community schools grant, we got 49 million. So that was huge. But it's also fading out. So fee schedule is kicking in. So I have a high expectation to generate a high numbers to continue that. But I also can't be reliant on just that one source. Because some of those local grants, I've got all the way down to SEL for us. We got a micro grant for $10,000. So really just being open to all types of funding sources so that you can, do what works for your community, and put the services in place that work for your community. But again, like we can't be dependent on one source. It has to be multiple and ongoing looking for additional sources.
Yeah, I mean, it's sort of how you characterize it, right? Blended and braided. Yeah.
That's
Okay.
how yeah.
Let me just get through a few slides and we'll come back and do Q&A. Thank you, Kara, for all that great information. And I'm sorry I interjected, a few times. I just feel like ask some clarification, but we have a ton of resources available at the CSHA, from our most popular tool, which is our Vision to Reality toolkit on how to start and sustain your school-based health center, to key steps to planning. I mentioned earlier the Inland Empire School Health Coalition. We're actually going to have our last meeting a month from tomorrow, actually, and we're going to be touring a new wellness center site in San Bernardino City Unified School District. So I think those of you who are on this meeting, I'll make sure that you get this announcement from Mara's team. And then I mentioned earlier, we have our conference coming up in 2 weeks. Registration is still, happening. And then contact information. I'm going to stop screen share. So Mara, if you want to open up to people with questions for either myself or for Kara.
Yes. So if you guys have any questions, you can go ahead and just unmute yourself. And then, or if you would like to put it in the chat, I can also read it in the chat as well. I don't see anything in the chat yet. I know it's a lot of information to process and digest, so totally understand it.
I was gonna say everyone's ready to replicate OMSD and hire a Kara.
It's also great to see familiar faces, Miss Layla and Miss Kara from Upland. So yeah, I mean, there's great things happening all over.
I have a question. One of our counterparts is in here too, and we were talking about, Kara, can you explain more about the transportation piece? That was really interesting to hear for the different appointments and maybe how that was funded or how you were able to get that going, because that is just really, really interesting.
Yeah, so it actually started as part of our DVH PEI contract, where we were providing, but again, like I shared, no funding source can fully fund anything. And so we pull in a couple of funding sources to make it happen. But that's where the idea came from, is being able to provide transportation to medical mental health appointments for students and for families. Yeah. And so we have we call it the van, but it's kind of like a mini SUV. And so that, and we even have car seats available so parents don't have to bring their own. So really wanting to, remove that barrier for them.
Great question. Any other questions? All right, well, if we don't have any questions, we can go ahead and give you guys back 6 minutes. But very quickly, before we wrap everything up, I just wanted to say thank you guys for joining us. Thank you, Cara and Sang, for taking the time today to talk about this important topic. A lot of our districts actually are always asking about how they can better, improve their mental health systems at the school district level, and especially like infusing partners is super important. So I just want to say thank you for doing that for us. Also, we're going to put in the chat a feedback survey. So if you can just please take the time to complete the survey. This actually helps my team and Sang, because we've been doing these webinars for the last 4 years. So it helps us with planning and just like what topics you guys are interested in, want more of. So then that way, when we plan for the next year, 26, 27, we're able to, pull from that information. So thank you again. And also we'll be sending out the recording and the slides as well. So appreciate it.